Okay, so hi everyone, it's really great to see you and welcome to the Doctors in Distress webinar for our launch for our long COVID programme. I think we just have Emma joining. Yes, so it's great to see you, Emma. But yeah, thank you everyone for coming today. My name is Susannah and I'm Head of Programmes for Doctors in Distress. So for those of you who are wondering what today is all about, today really is an introduction before we start our long COVID programmes in a couple of weeks' time. So today we have run 2 programmes for doctors with long COVID and 2 programmes for nurses with long COVID. And we've seen the amazing impact that these programmes and people coming together have had on the mental health and well-being for those with long COVID. We know that a lot of people who have long COVID have been struggling with feelings of isolation, with feelings of guilt, of not being able to work, with feelings of anxiety. Maybe this is something that you can relate to, or maybe there are other things that you're feeling that you want to talk about. But we know that these groups are a place where you can share anything that you're feeling and speak with people who are in a similar situation to you and who can relate to you, and you can get support from each other. So what we want to do today really is for you to meet the facilitators who you can see on the screen. That's Gavin and Geraldine, who will be running the groups. They're both wonderful people, and I know you'll have a great experience with them. But also for you to hear from Emma, who attended our groups, and we'll hear a little bit more from Emma later, but about her experience. So before we speak with our facilitators, I just wanted to explain about the structure of our groups and a few practical things. So all our groups are run on Zoom. So before the groups start in about 2 weeks' time, on the 8th of February, you will receive a Zoom link. And during the first session, you will be placed into breakout rooms. So these breakout rooms have no more than 12 people on them. And you'll be in that breakout room for the full 9 weeks with your facilitator. We'll hear a little bit more about the facilitator's role with Geraldine and Gavin, but just to say that they'll be there to guide conversation and support you where necessary. It's really important for us to say that everything that you share is totally confidential. None of your information will be shared externally, and that's a really key part of our groups. Additionally, whilst we'd love everyone to come to all 9 sessions, we understand that long COVID is a really unpredictable illness. You don't know how you're going to feel from each day to the next. So if you can't come 1 week, please do not worry, you'll be welcome the next week. And it would be great to have you as many sessions as possible. So as I mentioned, the groups are going to start on the 8th of February, and they will run each week for 9 weeks from 11 to 12:15. So that 75 minutes is your chance for you to come and share with people and be with other people in a similar situation to you. So later on, I will put my email in the chat box. If you have any questions, please do feel free to email me. If you have any concerns, do let me know, and I will try and clarify those as much as possible. So that's my blurb done. Thank you for being patient with me. And now just going to speak with the facilitators a little bit. So Gavin and Geraldine, if you could unmute yourselves. Thank you. So just as by means of introduction, starting with Gavin, could you just introduce yourself, who you are, what you do, and then we'll hand over to Geraldine.
Yeah, thanks, Susannah. Yeah, so my name is Gavin. I work as a psychotherapist and group facilitator, and my experience with Doctors in Distress has been a similar program that we ran in the autumn winter with allied health professionals. So yeah, I don't know if you want me to say more or just sort of pass to Geraldine after that introduction.
Yeah, we'll move on to more in a minute, but Geraldine.
Hi, my name is Geraldine. I've also been facilitating groups with doctors in distress, and I'm a cognitive behavioural therapist. Also, I'm a social worker as well, so I deliver a lot of kind of group work programmes as well as facilitating here.
Brilliant, thank you. So you both mentioned you've led groups for us before. What's your experience of the groups? Can you explain a little bit about what to expect? What are they like, Gavin?
Yeah, so I mean, my first it was a wonderful experience working with the allied health group, and yeah, over the same sort of duration, I think it was like 9 sessions. It was great to see like how much the group bonded, how much they saw the similarity in each other's stories, each other's difficulties. But also there was enough space as well, enough kind of intimacy and trust in the group that they could all talk about their differences as well, because you had people in different positions within the NHS hierarchy, and people that brought in sort of different experiences and perspectives from their life before they got long COVID or before they had the shield. So they started to see it as basically kind of a support group, and I noticed that I had sort of slightly less and less of a role as time went on in terms of that, like kind of guiding the conversation, just sort of overseeing it, really making sure that we kept to what seemed to be kind of relevant and on track, and maybe offer some perspectives or kind of framing things back to them. But yeah, they were doing a lot of that support just within themselves, which was really, really great to see. And they all spoke about how empowering that was as well, that to see themselves not just as victims of the situation, but also as people that could support others, which is obviously something that's pretty fundamental to your experience as doctors or allied health professionals. So yeah, no, I could go on and on, but I think I'll stop there.
Well, we'll let you go on and on a bit, Gavin, because it'd be great to hear more. But Geraldine, do you have anything you want to add there?
No, I would just echo what Gavin said in terms of the kind of facilitation. I remember the first session's been slightly awkward because it seems to be a kind of culture in the health service that people don't really share how they're feeling, and see that as a sign of weakness. But as the sessions kind of move forward, and more people felt that trust and that support for the other people on the group, they were able to talk about their feelings. And one of the things that always came out was that it was nice to speak to other people that were having the same sorts of feelings as them, because it made them feel kind of less isolated and less lonely. And I know there was quite a disparity in terms of the area they lived in and the services that were provided. So they were sharing kind of information within the group, I suppose, to this is what I did, why don't you try that? That might be helpful, and how they were managing on a kind of day-to-day basis as well, and what they felt helped for them. So I think the group really kind of benefited from that. And going forward, what they'd done was they had set up their own kind of WhatsApp group as well, so that they could keep in touch. But they had commented that they would have liked, obviously, the sessions to continue and be longer, but we know that was time limited. But they certainly benefited from that. And as Gavin said, my role was less and less because they were then able to kind of support, and I just kind of sat in the kind of background and just made it sure that they kept on track. So yeah, it was really good. I thoroughly enjoyed it.
Oh, good. And I think it's probably important to say we're very happy with awkward. Awkward's okay if it starts off that way, and it sounds like relationships build, and that's why we have Gavin and Geraldine there. So by no means do you have to log on and kind of share your innermost secrets on week 1 or even week 9 if you don't want to. Gavin, is there anything you wanted to add?
Well, probably loads, but yeah, just I mean, I didn't specifically mention something that Geraldine said, which was really important, was because specifically in my group was in the allied health program was people that were shielding, so it was like a massive kind of counter to the isolation they felt, both kind of the physical isolation of having that contact with people, although it's on Zoom, and also a lot of them were, well, I think everyone in my group had said how they felt like it was just them, even though they knew in theory there's whatever 1,000 people with long COVID or shielding in their direct environment. It just felt like it was just them, and they were very kind of became very emotionally connected to the group as that kind of living proof that it's not just them. It seemed really powerful for them.
Yeah, and I think that's really important, isn't it? And I know Emma will talk about kind of the sense of isolation with long COVID, and the same for shielding as well. But just to know that there are other people out there really, really does help. I think it makes you feel better, and that you're not kind of somehow different in some way, that other people are going through the same thing as you. what kind of thing can people talk about in these groups? Is there a theme discussion? I know we're talking about long COVID, but are there restrictions to what you can talk about? Geraldine, maybe you can start this one off.
I guess there kind of wasn't really any restrictions. I guess it was just providing people with that safe space to talk about just how they were feeling. If they wanted to talk about, like what you picked up earlier on, that they don't necessarily have to share their innermost feelings, because some people, it does take a couple of weeks for them to kind of feel comfortable within the group to then kind of open up and share. It was very emotional, quite a lot of emotion came out, you know, but the other members of the group were brilliant and actually supporting them through that as well, you know. But I guess what you wouldn't be sharing was anybody that was taking kind of formal complaints or anything, you know, because it is about, because you need to question how useful that is and the kind of safe space that we're providing for people. So you need to question then what's relevant and actually what's not. But you know, it was really helpful in terms, because some of them were having problems with feeling that pressure to go back to work, which was quite a common theme that run throughout. So they were able to share actually how they managed that, and what the person could possibly do to manage that. They also shared bits of research, because I know COVID's relatively new, so they were sharing research articles as well, which they found dead useful. So what they do, they would go away, do the bits, and then come back and have that. Then they would have that discussion. So sometimes it was a lot. It was free flowing, but they would bring in themes that they'd spoke about in the weeks before, and bring that back together and then share their experiences. You know, so if somebody was going to visit a consultant, everybody in the group was dead keen to hear how they got on and what was happening, you know. So you could see that bond developing with the group as the weeks went on, which was lovely to see. Yeah.
Gavin, you're nodding.
Yeah, just in agreement. I'm not really sure there's anything I would add. Yeah, I think that was quite a good description.
Yeah, so it's well, I guess we're trying to say, and Emma and Chris hopefully will echo this, and hi to Chris, it's good to see you, is that it's a real community of support, that you can come in, you can talk about anything, and it's amazing how close you can get to people in just over a series of 9 weeks, considering you haven't met before, but there's this one thing that kind of brings you together, and that's really key. So I've mentioned it before, but just a final thing for Geraldine and Gavin to cover, really, just is everything in the group confidential?
I mean, the short answer is yes, but with the usual caveats that, as doctors, I'm sure you're fairly familiar with, around, you know, if people were saying things that indicated a risk of harm to themselves or others, then, you know, we'd have, you know, I would pass that on to Susannah. But other than that, then yeah, it would be.
Yeah, brilliant. Thank you, Gavin and Geraldine. I think you've given us a really good flavour of what to expect in these groups. So we are now going to move over to our other speakers, Emma and Chris. So I'll let them introduce themselves, but both Emma and Chris have been on our groups before, so have kind of lived experience of what to expect as a participant. So Emma and Chris, if I can just ask you to unmute and both introduce yourselves, who you are and what you do. Emma, if we start with you.
Hi, I'm Emma. I'm not a doctor. I'm a mental health nurse academic, and I have long COVID, and I think I did one of the early groups. I can't even remember when it was now. This is long COVID for you.
Yeah.
I can't remember when it was. And you know, I'll talk a bit more about it in a moment, but yeah, it was and still is an invaluable support to me. So yeah, welcome.
Brilliant. Thanks, Emma. And Chris?
Yeah, thanks for inviting me. Yeah, good to speak on this panel. So yeah, similarly, I was thinking back, when did I get long COVID? And of course, my memory is not quite so good as it once was. But yes, I think one of the first groups is my understanding I was part of. It was just invaluable. I think with long COVID, you can often feel quite isolated, quite alone with your symptoms, and obviously from your colleagues. And so yeah, I just found it invaluable to connect with others. My background, so I was working as a GP partner. I've since resigned from that, but I am back doing some clinical work again as in a salaried role, and also work as a medical educator. And I'm a dad to 2 children. So that's my background. I'm not sure if you want anything else, Susannah.
No, that's an excellent introduction, and we will move on to other things. But just to say to everyone, the chat box is open. If you have any questions for either Emma or Chris, please do pop them in, and we will put them to them as we speak. So I wondered, Emma, we'll go back to you here. If you can tell us a little bit about your COVID journey, when you got it, what life has been like since, and then Chris will move on to you.
Yeah, I'll try and remember all the pieces. So I was working as a nurse academic, and obviously when COVID hit, it was extremely busy, as it was for you guys, in a different way. We weren't front facing, but we had to jiggle around nurse education and, you know, all the demands that meant. But I was really well, I was fit and healthy. I would say, as some of my students say, living my best life. I was studying, I was doing my PhD. You know, I was really in a good place. Picked up COVID in October 2020, so pre-vaccinations and everything. Was very kind and gave it to all of my family, including 4 sets of, you know, elderly parents. And we were all quite unwell with it. I was particularly unwell, and ended up with COVID pneumonia and various things. And never been in this situation before. I normally had bounced back from any kind of illness that I'd had, which, touch wood, I've been very lucky. Lots of complications, which I still am having around long COVID. I was off work for 8 months. I felt a terrible sense of guilt in how did I get this? Because I had shielded with my son. My son's 24. But he has Crohn's disease, so he was shielding and I was working from home, so I took the kind of emotional, to support him emotionally and work from home. So I've been very, very careful. So I was questioning, how did I get it? I felt terrible for passing it on to other people, and I felt really guilty that I wasn't recovering. I was doing everything that was suggested, but I just didn't seem to be going forward. In fact, I was getting worse. So involved in a whole range of navigating health services in the middle of a pandemic where nobody knew the answers, and as a health professional, that's very isolative, quite frustrating, although you can see the context of the pandemic. So emotionally, it had a real toll on me, as well as physically, obviously. And I didn't really know, although I was very good at educating other people, how to, my passion is about emotional well-being in healthcare. I just didn't know what to do with it myself. I felt I'd lost my role as a nurse, as an educator, as a mother, as a wife, as a friend. I felt really useless. Came across the support group. Like most health professionals, initially I was a bit anxious, you know, oh goodness, you know, how can this help me? I know all the answers, but actually I didn't, because I wasn't progressing at all. So joined the group, as was a nurses group. Very fortunate to have a lovely group. We just gelled instantly. In fact, had a couple of come-ins and go-ins in the first couple of weeks, but that was okay. And we had a small group and we just really gelled. We had Fiona as our facilitator. She was extremely skilled in just listening and nudging us just gently to maybe think out of our comfort zone, which was really good. And I just think that identifying with another health professional, we're all very different ages, roles, life experiences. Our COVID journeys were very different. but we supported each other so much, and I really look forward. I think ours was on a Tuesday, you know, and I really look forward to that. It just gave me a sense of belonging, and we did share tips, you know, and things that were helping, and we still keep in touch, not as much as we did. It's, you know, it's become less and less, which I see as a positive thing in some ways, because I think we're perhaps moving forward and back and whatever. But as someone who's quite apprehensive, who really felt like, well, I know what I should be doing, I can deal with all my emotions, it really made me stop and think, actually, you're not dealing with this as well as you're pretending to the world you are. So it really, really invaluable, and it's been good to keep the connections with the participants, but also with Susannah and the team in different things. So yeah, that's a bit about my journey, but I'm happy to answer anything that might help.
Yeah, well, we've actually just had a question, and Chris, I will come to you, but saying I'm mildly affected and managing to work at reduced hours. Is this group for me? Yes. You don't have to be a kind of certain level of long COVID. There will be some people that are very seriously affected and can't work. There will be others that are working, but still have long COVID, and the effects of that are very real. So don't feel like you have to kind of be a certain level of ill or anything like that. That's not the case. So please do come and just try it out. It might be for you, it might not be, but don't feel like there's any kind of level that you have to be. Chris, could you tell us a little bit about your long COVID journey, kind of when you got it and how you've been since, and how it's affected you?
Okay. Yeah. Can you hear me okay?
Yes.
Yeah, okay, great. So yeah, I mean, I had it in the first wave, similarly to a lot of the group participants, and when we weren't doing testing and stuff, and but you know, pretty barn door symptoms, you know, knocked off my feet for about a week, and then unexplained breathlessness 2 weeks afterwards. I think something like that kind of second wave that you sometimes get. And then seemed to recover, not fully, but mostly. Again, like a lot of participants, was fit and well, doing half Ironman triathlons and various other stuff. I kind of almost have to exercise because I've got ankylosing spondylitis and didn't want to go on to biological therapy. So I sort of swim, run and cycle every week, or used to pretty regularly. And so was trying to go back to stuff, wasn't quite right, but was more fatigued really than I used to be. And then in October, the kids brought it home again, and we just sort of knocked off my feet with fatigue. Interestingly, my son, I think, has probably got dodgy genes from me. He's 16. He was also affected more than the rest of the family. Yeah, found it very difficult to concentrate. The brain fog that people describe, I think, is an apt sort of summary for how it feels, and that you just can't really think of the right thing, word, drug, whatever it is you're trying to prescribe. And so work became very challenging. It was already challenging pre-COVID, but I ended up going off sick for I think it was about 3 months, but I was on an extended phased return and had some occupational health assessments. And I think one of the things that we discussed in the group and was invaluable was obtaining an occupational health assessment. And I think previously I'd been a bit reticent to kind of involve that and as an avenue, and realised that it could be actually supportive rather than someone who's going to say you must not do this. But it was, yeah, that was, although there was a variety of experiences in the group, not everyone had the same level of support from occupational health. And that was good to discuss as well. That, you know, there's variety and yeah, kind of in terms of quality of service, depending on where you live and who you work for. And being a GP partner, I think, unfortunately not an employee, was occupationally quite difficult. Although I could get that assessment, I had really, as time went on, I had to make a decision what to do, because I was kind of, there was leverage for me to attend work and partnership meetings that were often in the evening, and would leave me knackered for the next day. And I think acknowledging that the next day knackeredness wasn't just a coincidence, this was part of long COVID, did really help to rationalise decision making. And I was not alone in resigning from my partnership in the small group we had. But then, of course, it was tricky, because all that employment protection that I was paying, insurance, didn't kick in because I'd resigned. So there was, I think the group really helped just to acknowledge the various challenges we had around work, not just emotionally, as Emma was saying, around sort of guilt and shame, and loss of role, and anger, really, that some of us felt so let down by a health service that wasn't really necessarily thought to be doing enough to protect its own workforce. And so I think so losing that was a bit of a low point. But then what really helped in the group was not just the emotional, the validation of, like, what's really going, is it me? Am I just depressed? And I think, often people were saying they were getting told they were just anxious, just depressed. I say just, I mean, that's not, but actually we all knew there was more to this. And so the fact that there wasn't an exclusion criteria for the group, the fact that it was welcoming, we were able to validate each other's experiences and then share information. So what became really quite apparent was that I was getting POTS-like symptoms, and sorry, 3-letter acronyms, postural tachycardia syndrome. And that this did seem to be quite a phenomenon that many of us in the group were experiencing, and could assess for quite readily. And you can do something about it. The fluids and the leg exercises and various other things was really really useful and transformative. These waves of fatigue that I was getting after eating, after doing things, I could actually start to head off by drinking more fluids and electrolytes. So I think that really helped. And then I was able to start to get back to work and back to work at the university. And I'm now doing clinical work again, just a couple of sessions a week. And it is hard. Mentally, I'm not quite as good as I was. And I think there's probably, I haven't had a brain scan, but I don't know, but I imagine there is some impairment that might be seen on that. But I've kind of almost sort of stepped back from trying to seek other scans and stuff, and just trying to move on with what I've got, and doing some mindfulness, slow abdominal breaths, trying to avoid caffeine first thing, all these things that we talked about as useful things. So I think for me, the group was just so invaluable to head off the loneliness, to validate your symptom, to share information about what really could be useful. And so I think this peer group stuff is not, it's not just for us. I think for me, it made me realize that this is a model that can transform care. It was just brilliant, really. So yeah, not quite back to where I was. I was first up the hills on my bike before. I was good at climbing hills, and now I'm last if I try and go out. But I am going out, and I am, aware of what to do to head off the postural symptoms, even if I can't do exactly what I could before. So I would say 80 to 90% where I was. So yeah, but that's sorry. Yeah.
No, it's brilliant, and it's great to hear both of you kind of how you're dealing with the changes in your life, and I think that's maybe something we'll pick up on in a little bit, how your life changes and how to kind of deal with that. Geraldine, did you have your hand up today, or was it a twitch? Oh, you did. Okay.
No, it was my hand up. Yeah, I guess what Chris and Emma are saying was kind of resonating with me in our group as well, and it's about the feelings of guilt, because they go into the health profession to help other people, and then when they need the help, it's really quite lacking, and that varied for area to area, and all these feelings of guilt and everything else was a very commonality. And also the bit that you were saying, Chris, financially, that was a big pressure on staff as well, because they knew they weren't ready to go back to work, because they were, even although they were having phased return, the conditions very misunderstood by the NHS, the staff that they were going back with, and they were worried about how they were going to manage financially. Once their pay reduced, when they clearly knew that they still weren't well. And then they were also worried about what their colleagues were going to be thinking about them as well. If they've seen them out, maybe like yourself, Chris, maybe out a walk or a run or whatever, and they think, oh look, they're out doing all that, but they can't come to work. Do you know? So there was lots of that going on as well. So they were another lot of commonalities between the group, but everybody was really good at supporting one another through that, and giving advice, which was excellent.
Yeah, and I think you both mentioned, actually, it'd be interesting to hear your thoughts on this, kind of the concept of getting support for yourself, and Geraldine, both Geraldine and Gavin have spoken about this, is quite alien to all healthcare professionals. So what was it, firstly with you, Emma, what was it that made you get the support? Because you were saying, you know, it's not something necessarily that you would have gone to before. So what was it that kind of convinced you it was something that's worth a try?
Yeah, I think certainly for myself, you just get to that point of being desperate, and I don't mean desperate in a emotional, you know, depressed, suicidal or anything like that, but you just get to the point where I felt really stuck. So physically things were happening, and like you could make some sense of that, but like Chris mentioned, a lot of the frustrations and the navigating and feeling a little bit, you know, I've advocated particularly for people with mental illness my whole life, and I suddenly realised what it's actually like to try and navigate a system, particularly in a pandemic. And I think you have a lot of time to think, and just thought, you know, I have to try different things, because this is not only impacting me, it's impacting particularly my family around me, because they didn't know what to do or what to say. I'm normally the one, and I think most health professionals in a family are normally the one who solves everything else for everybody else, and here was me, I didn't have the answers, and as much as I knew the evidence and the research and stuff, it's hard. I think it was Jan said, it's really hard to apply that to yourself. It's very easy to suggest to other people ideas. So I was just like, you know, it's not going to do me any harm, and I can sit here and feel sorry for myself or feel frustrated, but I have to do what I can when I can. And I think that just pushed me. I had been involved in a support group locally, which was really helpful, but it wasn't health professionals, and I think we are a unique breed. And so, you know, I could identify with a lot of what they were saying, but I didn't know anybody else in a health profession at the time who had COVID or long COVID. I was the only person all around me. Everybody else had recovered in my family, and so yeah, I guess I needed that belonging to something. But yeah, so it's just I need to do what I can.
So it wasn't necessarily something that was usual for you in a way. You're not someone who kind of goes to these support groups all the time, and it was quite nerve-wracking. I think a lot of people were feeling quite just a bit strange about it, really, and not really.
Absolutely, yeah. I'm very used to facilitating. I'm used to being the Gavin and the Geraldine. You know, I've done that all my career. So peer support was something I knew tons about, but I'd always been the facilitator. So it was a real headbend, allowing yourself to be vulnerable, I suppose, because you're normally the one in control and managing other people's vulnerabilities. So you know, it wasn't easy, but it was so worth it. I think it was probably a bit of a pivotal change, not necessarily in how I was with my long COVID or how I am now. I've still got lots of complications, but in how most days I think about it. Some days my old habits creep back in.
It happens. It happens.
Yeah, but on the whole, I think a bit like Chris said, you know, I'm nowhere near what I used to be, but I've learned most days to just go with what I have.
Yeah.
It's a different way of living, but you know, rather than fighting and looking for answers all the time, that's exhausting in itself. So I've kind of, and the group helped me to do that.
Yeah, I wonder, Chris, if you can talk a little bit more about that as well, because obviously both of you were very high achieving, busy, active people. And then to suddenly be struck by something that takes a lot of that away, including your career. And I think for healthcare professionals, a lot of the time we talk about the identity of being a doctor or a nurse. You aren't, it's not just your job, it's who you are. So to have that kind of taken away from you, how did you adjust to the change in your lifestyle? And how did you come to the decision really of kind of resigning from your job and all these things? Was that something the group helped with? Was that, you know, what was that process like for you?
Yeah, thank you. Yeah, I think it was like a bit like the stages of grief. And I think what came up, as I mentioned, not uncommonly, was anger, but then processing it within the group, and we'd be at our own perhaps sort of point in that sort of trajectory at different times. And so it in a way that was good, because, you know, when one group member was struggling more, we could then as a group be more supportive, and then vice versa. So so that was really helpful to validate not just what you're struggling from, but what you're struggling with on a day-to-day basis, emotionally, as well as responsibility and role loss and all that sort of stuff. And in some ways, you know, when I was off work, at least I did have the headspace when the fatigue was sort of, you know, kind of not so bad, to kind of think with a bit more clarity, and to just realize, well, I can't do that anymore, so I'm going to have to change things, and I'm going to have this occupational health, you know, and assessment and all that kind of other stuff. In a way, it kind of helped to get some clarity, just to kind of acknowledge everyone, actually probably do need to be off work. I probably can't do this right now safely for me, but safely for my patients. Okay, make that decision. Next, okay, well, I'm going to be able to carry on with that role. Probably not. What can I do? Initially, it's, you know, it's being off, and then once, and not everyone in the group was at that stage. Some people would say, well, I'm not ready to say that. I want to keep going to work. I want to keep at it. And I remember having feelings sort of, you know, saying quite strongly, thinking, but hang on, you're unwell. You need to be off work. And there was sometimes some challenging dynamics around that, because of course presenteeism is part of being a health professional to some extent, or it becomes part of your habitual response, if you like. And, you know, going back to Emma's thing about habits and how they do take a while to acknowledge before you can then challenge them, if challenge is the right word. So yeah, it was kind of supporting each other in those decisions, I think, was really useful. And then acknowledging, you know, this is a bit shit, sorry. But people would, like, you know, I can't do this and I feel let down, and then, well, what can we do, you know? And so it was a bit of a lifeline, really, and well, more than a bit, because unfortunately standard NHS care was not really there, and we had to rationalise that as well. You know, we're in a pandemic, and so for me it's like, okay, well, I can't access my GP as much, and the group, not that it was providing this, you know, individual care, but it did provide that sort of opportunity to think out loud, and then research some of the stuff that we provide each other, with the caveat that we weren't each other's doctors, and nor was the facilitator. But yeah, so it was, it really was invaluable with some of the decision making along the way.
That's really interesting what you say, Chris, about we weren't each other's doctors. I think for healthcare professionals, it's really hard to switch off. I mean, you mentioned it as well in your family. You're a doctor, so you help and you diagnose, but but actually sometimes it's helpful to focus on yourself, but that's a really alien thing to do. No, go on, Chris, what are you going to say?
Yeah, just although inevitably, given the kind of gap in service delivery, unmet need, and symptoms and all that stuff, and what because we were sort of almost filling the void here a bit from lack of care. We did I think the information sharing bit did initially really help, because I thought, well, there's stuff I can do to help the symptoms, so long as I don't overdo it and go down a rabbit hole of which very easy. I mean, in some ways it was necessary to do that initial stuff, if it was initial or along the way, to kind of work out and process, actually, this is probably what's going on. Let's give this a go if it's not going to do me any harm. But ethically, it does. You're right. It does raise some questions, so long as I wasn't self-prescribing or any, But some of this stuff was quite, leg exercises and fluids. I thought, well, I'll do that, and slow abdominal breaths. It's probably not going to do any harm. But it did. It kind of, the edges became a bit blurred of some of those ethical boundaries. Although we had to acknowledge them, because we do still have a duty, as you say, not to completely overstep them and seek medicines for which we were not, we've not been guided to take, or what have you. Although I know some people have done that in other forums, but that does make it slightly trickier for us, I think, as well as doctors or healthcare professionals, I should say.
Yeah. So did you? Maybe this is something Gavin and Geraldine can kind of add in on as well. But we always talk about when someone has an illness, you look at the physical, and you don't always look at the psychological. And I guess what we're trying to do here is to address the impacts on well-being and emotional well-being as well. It's a bit of a leading question, I guess. Do you think this is important? Did it help your recovery to look at that emotional side as well? And Gavin, is this something you've seen in the groups as well? Maybe we can start off with Gavin and then move on to Emma and Chris.
I mean, yes. It's I think the certainly in the last group I had, it's true that one of the participants was a clinical psychologist, which I think had quite an interesting effect on the whole kind of dynamic of the group. She was almost a bit of a kind of assistant facilitator sometimes, but it was interesting, to see her sort of also kind of let go of that a little bit, but allow herself to sort of be the focus of her own care. But I think there was that overall this sort of recognition of the importance of their mental health and how that was part of kind of untangling that as much as we could from their what other symptoms they might have had, or their I mean, as I said, my group was more kind of shielding, so there wasn't so much in terms of the kind of physical symptoms. It was more how do we deal with this situation practically and deal with their anxiety around catching COVID in the first place. But another thing I wanted to just sort of bring in as well that was quite important, it's come up a little bit, is this that it was a safe space for people to talk about some kind of even kind of feelings of resentment or betrayal that they felt towards the healthcare system in general. And some of them spoke as well about what it felt like to be not just a patient, but to be a kind of difficult patient. I heard of that, or a difficult employee, and just this feeling of kind of resentment and not feeling cared for, which I think they said also not only sort of transformed a bit how they saw themselves and that kind of identity, but also kind of facing other patients in the future, some empathy about what it's like to be a difficult patient or a difficult employee in the NHS.
Geraldine, you're nodding. Is that something you experienced as well in your groups?
Yeah, it was that being on the other foot, really. How they found themselves as health professionals, the frustration and trying to get the support that they needed. And as Gavin said, it's about the mental health part as well. And I think for a lot of the groups that I worked in, self-care was really quite important. And you know, their NHS staff are quite driven individually, you know, to provide the best care, actually, but they weren't looking after themselves. So it was a bit like what you said, Chris, about the stuff that you do in terms of your cycling, etc. And we'd an OT on our group as well. Sometimes he felt like he was co-facilitating as well, Gavin, but he spoke a lot about self-care as well, and kind of diaphragmatic breathing exercises. And he done a lot of self-care. He just took himself away out to the wilderness because he loved this rough camping and everything else. And actually he was able to go back to work before the end of the group, albeit on a kind of phased return. Although he was still quite unwell, but it was so much better that he was able to go back to work. But we really spoke quite a lot about self-care and what people were actually doing to be able to look after themselves, rather than trying to look after patients, even children and family, and do the things that you would do as a mum or a wife or whatever. Actually, let's focus on you, which some of them found quite alien and difficult. But definitely would report week in, week out about trying different techniques, etc., and actually how they were finding that they were really helping.
Yeah, and I think, Emma, maybe you can speak to this, because we can't say that we're going to cure all symptoms of long COVID at all in any way. And I know, Emma, you are still suffering with various side effects, but it does sound like this kind of ability to speak to people and share does empower people to a certain extent. What would you say to that?
Yeah, I think, like Chris says, sometimes when you're in almost like the acute or, you know, the early stages of long COVID and you're off work, and in some ways it's all the self-care stuff and that as well, picking up on what you were just saying there, Geraldine, is almost a bit easier. It's very alien and all of that, but you actually you know, you can get into some routines, and a bit like your OT guy, you know, I tried cold water swimming, breath coaching, you know, a variety of things that I never would have perhaps explored before, which has all been really positive. But I guess picking up on that and where the group helped, and I think, you know, it's good to then we have still got that connection, is because as you know, I've been lucky enough to return back to some form of work. It's early days and I'm still in that decision making of what I'm going to do. But it's almost harder then to keep those routines up, because, you know, I was in work yesterday. I very rarely go into university. I work from home a lot, which I'm lucky. But people say, oh, you look well. And it's almost like they think, oh, Emma's back to normal now. And I'm far from back to normal. And I think that self-care thing and remembering the group, or just checking in with the group members still, because we're still in touch. You need that. I think probably more now than I did when I was off work and unwell, because it was almost easier to do those things then, and you had the weekly check-in and we would support. So yeah, I think the group really helped me, and I sometimes reflect back on conversations that we had when I sometimes think, is this me? You know, should I be over it by now and just go back to being Emma, the nurse lecturer? But I have to put those self-care boundaries in, as you said, Geraldine, because otherwise I am going to go backwards. So yeah, I think the group really helped me, and I reflect on that, or I can go back to them and say, oh, how are you doing? And feel quite that sense of belonging again. Oh, it's not just me who's feeling like this, because the rest of my team, you know, still nobody else is in my situation. So I think they find it difficult to understand, you know, what Emma can and can't do.
And how do you
answer your question? If I've got
it has. And how do you deal with the kind of outside perception, I guess? Oh, Emma looks well, Emma looks fine, everything's okay. How do you deal with that? Because I know that's something that a lot of people.
Yeah, it's difficult. It is difficult, and again, it's really, as I think it was Gavin said, made me really think about, you know, genuine empathy, because as much as I would like to think that I really, you know, listen to patients or student or whatever it is, sometimes we do make assumptions, and you go through that almost like grieving again, feeling really angry, like, well, I'm not okay, and you know, but then that doesn't help you because you get all wound up and your energy. And so I just, you know, kind of smile, and the people who are really important in my work life, home life, whatever, they understand. And you know, sometimes you do have to be a bit assertive and say, well, actually I'm still not quite right, or I'm not as well and I can't do that. And that is really alien as a health professional to say that in the work environment, especially, because people look at you and say, what, you know, you would always do that. And it's not easy, but I think I just think, okay, it's, they don't understand, it's not them, it's not me, it's just a situation that we're in. And it's quite nice when you see sort of reputable evidence base coming out, and you think, actually, the people educating my colleagues about this, because you don't want to come across as one of these people that just going on and on and on, as well. So it's yeah, I just quite graceful, and I might come home and have a bit of a it's just wasted energy that I haven't got to waste on worrying about it. But you know, some days it's easier than others.
Really helpful. Chris, is that anything, can you relate to that? Is that something you've experienced as well?
Yeah, absolutely. Yeah, the phrase, you know, you look well, that Emma mentioned, I just, you know, it really riles me. It was like, well, yeah, I might look all right, but as we know, you know, we're in this messy land between being unwell and well, and what's on the outside is very different often from what's on the inside. And of course, we know that's the case for many. And I think, like has been noted, this does really give you empathy for other people that have struggled with this, or not dissimilar. I just saw a message in the chat, not dissimilar issues. And I do think there's a lot of people, and I have to kind of be mindful of my own bias, but from seeing patients as well, I do think there's a lot of people out there that have undiagnosed long COVID, or you know, post-COVID syndrome, whatever you call it, but also that did beforehand from things like Epstein-Barr virus or what have you, and have a, you know, this long-term chronic fatigue that they're managing, that really the health service, medical schools, whatever, don't really provide you with much training or skill on how to handle when you see patients, or let alone when you experience it for yourself. And so, yeah, so I think, you know, these groups just really provided that opportunity to share what we're going through, and to build that empathy for us as a group, that we can hopefully then, I mean, you know, ultimately, I think this was transformative, not, you know, not just through the personal living with the long COVID, but also for how you then deal with others in whatever domain, almost, really. So yeah, I think it's been really, really useful on just so many levels.
Thank you, Chris. We have a minute left, and I think that's a wonderful way to kind of wrap up. But I just wondered, Gavin and Geraldine, just if you had any, and Emma, any final comments or encouragement for people who might still be unsure. Gavin, if we can start with you. Sorry, I'm putting you on the spot there.
No, I don't have anything in particular. Obviously, yeah, just I'd love to work with any of you that want to come along. Yeah, that's all. Yeah,
wonderful. Thank you. Geraldine, Emma, anything to add?
Yeah, I had a look at some of the questions in the chat, and about people being unsure whether they should come along or not. You know, I think it's beneficial for everybody to come along, and it would. I really look forward to meeting my group. I guess listening to Em and Chris, it's reassuring that they've taken so much from the groups, and hopefully their experience of the groups will make you excited to come along and share your story as well.
Brilliant. And Emma's just put, give it a go, nothing to lose.
Absolutely. Yeah, I would just say give it a go. You know, some people came, a couple of people came the first week and didn't come back, and that's fine. Maybe it wasn't the right time or right for them, but you've got nothing to lose, and I think you'll probably be surprised at actually what you might gain.
Wonderful, thank you. And Aileen's very kindly put all our social media handles and my email address as well. So if you have any questions, please do email me. Anything about the groups, anything about future groups, whatever it might be, and I will respond to you. So thank you to Gavin, Geraldine, Emma and Chris. Thank you for everyone being so patient in the beginning with the technical problems, but it was great to have you all here, and I look forward to seeing you on the 8th. Thank you very much.
Thank you.